You said mental health affects physical. Well, physical also can lead to mental health issues. If you have cancer, you're twice as likely to develop
Yeah.
anxiety, depression. So this was really the biggest challenge, and I was working for a company in a leadership that thought there was an opportunity for us to do something big on it. So I spent the last 6 years in the company working on bringing the global community together around mental health, kind of the way we tried to do on HIV. And one of the biggest challenges still today is that the mental health community is very fragmented. There's just not enough
Yeah.
funding. As I mentioned, the quality of services and the coverage is fairly low, and so there's not a lot for people to galvanize around. But we spent the last 6 years trying to bring people together and put our heads together for a better outcome. And I think we're making some progress.
Yeah. Welcome to episode 76 of People Are the Answer. I truly believe that people are the only answer to the world's many problems. I'm Jeffrey M. Zucker, a serial entrepreneur, here to learn how innovators are creating outsized, transformational social impact and to shine a light on all the good happening in a world often hyper-focused on the negative. Today's episode features Craig Kramer, a mental health ambassador who spent nearly 25 years at Johnson & Johnson, helping them utilize their resources to create impact around the world. He helped create their global campaign for mental health, in which he represented J&J with major governments, international organizations, NGOs, private sector, civil society, and other stakeholders in leading a global initiative to help transform mental health care worldwide. Craig and I discuss his brief political career and time in Korea, our playing hockey together, his world travels while helping to create impact in healthcare, his deep dive in mental health and how it was personal for his family, and much more. Here is Craig Kramer on People Are the Answer. So, we are coming to you live from the Podcast Movement Conference here in Denver, Colorado, my hometown. I've got my buddy Craig Kramer here. And Craig, thank you so much for joining me on People Are the Answer.
Thanks, Jeff. Happy to be here.
It's great to have you, and we're hockey buddies. We skate together at my Friday morning skates, and let's just briefly talk about how hockey kind of brings people together.
Sure, that'd be great. So I just moved to Denver 2.5 years ago, and I was looking for a group to play with. I don't want to play in the leagues anymore because people are too competitive,
Yeah,
and I just want to get home and go to bed without injuries. And bumped into you at the rink one day and saw you had something good going on, and you were kind enough to invite me out. And it is a great group of people, men and women, all ages, all talent. And we get to play in the Magnus Arena of the former national champion Denver men's hockey
yeah.
team, and it's just the greatest thing because you feel, even though the seats are empty, you feel like what is it, a 1,500 seat
I think it's
stadium or
honestly,
something?
I think it seats like over 4,000
Oh,
people.
you just feel like you're living the dream.
Yeah, no, it is, especially since they finally redid the boards this year. But yeah, it's just hockey really brings people together. I talked about it on my episode with Martin Richardson from Dog Nation, and it's a great way to bring people together. And we're going to get talking here about mental health, and hockey for me is a great release for my mental health and kind of keeps me sane. So I love getting to play a couple times a week at least.
Well, and the fact that you have us playing on Friday, no matter how bad the week is, you get to end it on a high note.
Oh, exactly. Everyone there loves starting our weekend like that. It's awesome. And so let's start off by asking you a couple things. So, said your name's Craig Kramer. You're based here in Denver. What is your current role?
Well, I retired from Johnson & Johnson, the global healthcare company, at the end of last year, and I'm continuing my work in mental health by being on about nine boards right now, chairing a effort in Washington, D.C. to reform mental health in the United States. I'm in Denver. I'm on the board of the Mental Health Center of Denver. So my mission, I think, for the duration of my life and career is going to be trying to reform and fix mental health care in the U.S. and around the world.
Yeah, I love that. And that sort of speaks to this, but in life in general, what would you say motivates you?
Well, like probably most people, I want to make a difference, and I've been privileged to have a great education and work in some of the leading organizations in the world, and so I've seen what impact you can have And I want to keep leveraging that and trying to make a difference. I mean,
Yeah.
we're just one person, but for me, it's how do you bring the right people together to make a bigger impact.
Yeah. Yeah, no, I love that. It's feels good to help people and make people's lives better. And where did you grow up and what was it like there?
Well, I grew up in the only place in the United States where you can look south across the river and see Canada. A place
Oh,
called Port Huron. It's on
yeah.
the south side of the thumb of Michigan, and that in retrospect, that taught me two things. One is that the conventional wisdom is not always exactly correct.
Right.
Sometimes Canada is to the south, and the other thing was that I spent a lot of time going across that border. So unlike most Americans, I had this exposure to the other people in the world, and that you could understand yourself better by engaging those people. And if there's a through line in my career, it's this idea of there's a globe that's important to our well-being, and also that you have to look beyond the conventional wisdom and try to see the patterns and the what's over the horizon.
Yeah. And what was it like growing up in Port Huron?
Well, hockey was that's where I learned how to play hockey
Yeah.
around the age of 5, and my coming from Michigan, it's a big auto state, it's a big union state. Um, my dad was from a Catholic family. My mother was from a Lutheran family. That was another big influence, I think. Martin Luther, everybody knows, tacked those 95 Theses on the door of the cathedral, and that led to the creation of Lutheranism and other Protestant faiths. But the Catholics and the Lutherans didn't really get along, and there was, in fact, a lot of fighting and worse. So when my parents got married 500 years later, they were bringing together two cultures that even today, there's not hostility, but there's a healthy disrespect and skepticism.
Yeah.
And our families always loved each other, and yet we understood there were different cultures in our communities that had important values, and to this day we have important conversations.
Yeah, no, that's really cool to hear. And can you think of any experiences growing up that really showed you the importance of giving back and maybe led you in that direction eventually?
Well, there's certainly a lot. My parents were always involved in charity and politics, but one of the threads was that again, my mother joined the Catholic Church that was kind of frowned upon in the Lutheran community. And they got married in 1957. Well, in 1960, the country elected its first Catholic president. And up to that point, Catholics were viewed as sort of second-class citizens because the thought was that they only listened to the Pope. They weren't really, committed to America. And so that was a transformational moment for my mother, and I think for all Catholics, but particularly for her, to almost validate, I think, that she had done something that was maybe important. And so I remember my mother crying twice. My mother raised 5 boys, but I remember 2 times, and I'm sure there were others, but there were 2 times that I remember her crying. One was the day Bobby Kennedy was assassinated. So at that point, I was 7 or 8 years old, so I was old enough to be a little bit aware of the world and what was going on. And to see your mother crying, who was a very tough, person. The second time was when I got a scholarship to go to a place called Choate, which is the very prep school where JFK went to school.
Oh, wow.
And this was, this is where all the rich and famous and the aristocracy sends their kids.
I think they're known for hockey too, right?
Well, I'll come back to that in a minute. So I got the hockey scholarship to go there, and when my mother opened the letter saying that I was going to go to the same place as JFK, she just cried then. Yeah, my junior year, I was the goalie on the team.
I didn't realize
which
you were
wouldn't know
originally.
because I can't do that acrobatics anymore. So you only see me slowly skating up and down the ice. But my junior year, we had a perfect record, 17-0.
Wow.
We were nationally ranked. Obviously, there was no high school playoff back then, so that was probably the pinnacle of my hockey career.
That's awesome, though. Yeah, no, that sounds like a lot of fun. My pinnacle was also in high school, but it was not on that level. And so you went to Choate, and then I know you went to Princeton. How did you end up there?
Well, so I did well academically at Choate. I actually was elected student body president, if you can imagine this. I mean, it was the farthest thing from my mind, but I threw my hat in the ring, and you never know what's going to happen. And I was looking to play hockey in Division One, and so Princeton recruited me. The year before, they had 2 senior goaltenders, so I thought I'd walk in there and play for 4 years. Well, they recruited 5 goalies that year,
Wow.
and one of them was much better than the rest of us. He played every game for 4 years,
Wow.
and he was the team MVP for 3 of those 4 years. And you know, the goalie's never the MVP.
Right.
But he was he was so good, and so after my freshman year, I saw the writing on the wall, and I gave up hockey as a career at that point.
I mean, it's even just as a college player, such a huge time commitment, especially if to not play. So I can't blame you for that.
Yep, sitting around waiting for Ron Dennis to get hurt, but didn't seem like a valuable proposition.
Yeah.
And he never did, by the way. He was fantastic, good guy.
And how? So once you did that, how was the rest of your experience at Princeton?
This is where I think I really got into giving back. So I started joining and running different student organizations that either raised money or did work on behalf of underprivileged populations. And I ended up pivoting from medicine to public policy. So my degree eventually was in public and international affairs. And that, again, going back to this idea of international and global, and also kind of trying to think about bigger picture perspectives on things rather than just accepting the conventional wisdom.
Yeah, no, it's cool to hear how that transition sort of started. And from there, you went to law school at Michigan?
Yes. I thought I'd go back home to Michigan and start some kind of a political or legal career. And had a great 3 years at the University of Michigan Law School, and then decided to go to Washington, try to go to the big leagues. And I practiced law at a big Democratic firm for 5 years. Then I went to the Hill for 5 years, working for the Levin brothers, Carl and Sandy, who were from Michigan. And then when the Democrats lost the majority in the House, where I was working primarily, it got very boring because when you're in the minority in the House of Representatives, you have no power.
Right.
Your job is basically to strategically complain and get on the evening news or we didn't have social media back then, but so eventually I got a call from a headhunter, and this company, Johnson & Johnson, was looking for somebody who had global policy experience, and that's where I spent the last 24 years.
Wow. And part of that time initially in your career, you did some time in Korea?
Yeah, that's right. Right after law school, I then girlfriend, future wife, and I went to work for a human rights organization, and we did that for 1 year. Korea was my wife, my first wife, was born in Korea. Korea had a military dictatorship for about 30 years, I think, and they were having their first democratic election. So our human rights organization went in to monitor the election, just to sort of inspect basic fairness, but also work on issues like political prisoners, what was going to happen to them in this transition, freedom of speech and other kind of human rights issues. It was a fantastic time for 2 people who were fresh out of law school.
Yeah.
I mean, we landed in Seoul, and that first night we were sitting next to the U.S. ambassador at the inaugural party launch for a guy named Kim Dae-jung, who had just been released from prison. So he was one of the opposition candidates. Later became a Nobel Prize winner for his efforts to bring peace and freedom to Korea. So just a ridiculous place to be when you really don't know anything.
Yeah.
You're just you've just closed your books for the last time, and suddenly you're on the world stage.
Yeah, you have like a front row to this pivotal point in history.
Yeah, it was an amazing time. And
did you realize it at the time, like that it was a big deal, or it was just like that's life, like where you were?
No, I mean, the transition from military to democracy doesn't happen that often.
Right.
Because very few human rights groups came to Korea, we were kind of the only ones that the media could talk to who wasn't on one side or the other. Mm-hmm. So the Clyde Haverman of the New York Times, Fred Hyatt from the Washington Post, we were just constantly in touch with them, and they were covering this world event. I'll just give you one thing that happened that was just... So for many Koreans, whether they were 80 years old or 20 years old, this was their first time to vote.
Yeah.
and people lined up for miles and with just tears in their eyes to have this opportunity to vote. A week before the election, the North Koreans blew up a commercial airline that was coming back to Korea and killed that, it was over 100 people on board. And so on the day of the election, there was a healthy fear that the North Koreans might launch some kind of a missile attack. So when you were out there voting, you were not voting just against the military dictatorship, you were putting your own life in your hands. And when I came back to America, I realized how much we take democracy for granted.
Yeah.
When you saw people who were willing to give everything to just cast their ballot.
I mean, that rings so true today in our divisive world where, so many Americans are just so divided and hateful and, don't appreciate what we have here. We live in as messed up as it is, I think we live in a great country that offers us great opportunities. We've been able to get here where we are. And so a perspective like that, going to see something like that, really kind of frames it for you.
Yeah, one of the downsides of our current environment is that there's a growing, we're focusing more on ourselves now. What's America first? How do we take care of our own group, our own country, which is very, very important. At the same time, America is the world's leader, and we are, we don't have to be the world's policeman, but whatever we don't focus on ends up coming back to haunt us. I mean, look what's happening now in Ukraine. And so that, we are the only country, the only superpower that can go out and do those things. And my experience has been global. So I've talked to people in, over 50 countries, and I've hired people and worked with people. And so I have a sensibility about why it's important to work together. And I see that slipping away on both sides of the aisle now, that there's this focus on fighting each other instead of joining together to make progress globally on important issues that affect us directly, maybe even more than some of the things we talk about here.
Yeah. Yeah, well, that sounds like a really cool experience. You clearly were driven by impact early on, and then you joined the government affairs portion of Johnson & Johnson before eventually becoming the ambassador and chair of the Global Campaign on Mental Health. So just kind of give me a summary of your time, your 24 years at Johnson & Johnson, then we can dig in on some specifics.
Yeah, well, J&J is and was a global company. Half of our sales were outside the U.S. at the time. But we only had a handful of government affairs people in the U.S. because the company had this long belief that if they just stuck to their knitting, that they would be successful. That was starting to change because governments were regulating healthcare more and more all around the world. But we didn't really have anybody outside the U.S. when I was this international guy. So I spent the first 18 years of my career traveling the world, setting up outposts of empire for this. I worked out of headquarters in New Jersey. And I think I started in Japan, and I worked my way west to China, Korea, Australia, India, Singapore, Europe, and then my last hire was all the way down in the south of Latin America and Argentina. We did Canada, Mexico, so forth and so on. And it was just a wonderful time to get to see the world. I mean, a little guy from a little town in Michigan gets to go out and I was meeting with prime ministers, health ministers, presidents, doctors, country doctors, patients in rural villages, in big cities. It was really just a phenomenal learning experience, and we were all collectively making a difference in providing people with basic health care and basic health services.
Yeah. So what were your feelings at the time or now on Johnson & Johnson as a whole? It seems like they must have cared about their effect on the world and their global politics.
When you go, I later went to business school because the company figured out I didn't really know what I was doing on the business side. So I went to business school, and all the professors wanted to talk to me because Johnson & Johnson is sort of the iconic company, American company in the business world. And what it boils down to is the company has a mission statement. It's called the Credo. That we all abide by and we get compensated for following. It's not just on the wall; it's part of the DNA. And the Credo basically says our first priority is not the shareholders. It's in our case the patients, but the customers. Second priority is not the shareholders; it's the employees. And the third priority is not the shareholders; it's the community.
Wow.
So J&J is always at the forefront of environmental policies. We're at the forefront. We pay our fair share of taxes, which a lot of companies don't do. Work-life balance for our employees was something we've been doing for 30, 40 years. And it turns out that if you treat your customers as number one, your employees as number two, and your community as number three, you make a lot of money. And
Yeah.
J&J is the most successful company over the last 100 years.
Wow, it sounds like the impact and the importance of everyone was just really baked into the culture there.
Yeah, and so when something happens, whether it's a natural disaster or if I'm in the middle of China talking to a leader, I know that my North Star is what's the right thing to do for patients. And then our company will figure out how to make money off of that. For many companies, it's, well, I've got a widget to sell. That's my priority.
Right.
So when I was in business school, actually the Communist Party of China sent a small delegation to come find me because they knew I worked for J&J and they knew that I was the head China guy for policy. And they were trying to revamp their healthcare system. And they wanted to work with Johnson & Johnson because they knew that we would give them the straight information about what works and what doesn't. We wouldn't be promoting any particular products. And so we ended up being the tip of the spear from the private sector or the non-governmental sector, and brought a coalition of people together to work with the party and the government to create China's healthcare system. And it's, they've come a long way. Every person in China has an electronic medical record, which is good for healthcare. There's also a dark side to that when you live in a state that's collecting data on everybody. But everybody has a basic set of health benefits right now, as I understand it, and they're able to build on that base. And China also wanted to be part of the innovation sector. They didn't just want to be the low-cost purchaser. They wanted to be investing in biotech and that sort of thing. And you see that now in their leadership in that space, and really competition, healthy competition in the healthcare space.
Do you have a point of view on the current sort of tension between the U.S. and China, and even on the research side? Like, they've generally been so sharing in terms of scientific research, but there's starting to be debate around that and whether or not that's going to continue.
Well, I'm going to dance around this question because there's no simple answer that's going to not get you and me in trouble here. But China is a large country. Most of its population is not rich. They've done more I think they raised 300 million people out of poverty in the last decade. So they've done more than any country in the world to raise the overall standard of living. It's still a challenge for them. I mean, they have to make sure people are employed. Unemployment's quite high right now. They got a big bubble in real estate. So the command and control of communist economics is arguably undermining their progress. At the same time, they're going to be the largest economy in the world.
Yeah.
They're exercising their strength in the military side and the ocean. So it's a very complicated situation. I think there's no simple answer. You can't just cut ties with China and try to isolate them, but you also can't just sit back and watch the current trajectory continue, because it needs to be a partnership, and they need to hear from us that there's some course correction that would be helpful to the world and to them, perhaps. So the people who are working on this around the world in all governments and private sector, in China, outside of China, got a lot of work to do, because it's too important for us not to try to get it right.
Yeah. Well, let's move on a little bit. Tell me about your transition into the ambassador and chair of the Global Campaign on Mental Health with J&J.
Yeah, so I was working on all the healthcare challenges that the world faces. I work on cancer. I did a lot of work on HIV, which you and I are old enough to remember that this was the death sentence 20 years ago.
Yeah.
And there were millions of people, particularly in sub-Saharan Africa, dying. I worked on diabetes and obesity, which is a global phenomenon, infant and maternal mortality and health issues. How do you get our youngest people around the world to get a healthy start, which is, again, a big challenge in many developing countries. And then in 2013, my family had a couple of mental health crises. We lost one family member to drug overdose, opiates. This is before we knew we had an opiate crisis in the United States. And almost lost another to suicide. And so I started, when I was making my rounds, I started asking health ministers and others about mental health in their country. And I found that it was broken everywhere. the World Health Organization later said that when it comes to mental health, every country is a developing country.
Mm.
Our
Yeah.
own experience as a family was that it's very hard to get quality, effective mental health care
Yeah.
and affordable. A lot of times
Yeah.
insurance didn't cover it, so you had to fight with them. It took 3 to 6 months to get an appointment.
Yeah.
The providers were not necessarily following evidence-based practices. They had their own kind of bespoke approach, and so you spent literally, the statistic says it takes 8 to 10 years for people to find quality care that stabilizes
Wow,
them
that's
in the
unacceptable.
United States, which is unacceptable.
Yeah.
So it was the same everywhere, and so we have actually, Johnson & Johnson has one of the leading neuroscience pharmaceutical divisions. So they do a lot of work on depression and schizophrenia. And so I went to that group and also to our CEO, and we formulated this idea that we could do the same thing for mental health that we had just done for HIV. We'd helped do for HIV. We worked with lots of partners to reduce the stigma on HIV, improve the science and the treatments that were available, and then get the system to deliver that care to people all over the world. So on HIV today, it's not a death sentence anymore, it's a chronic illness. And there are actually people now looking at vaccines that would make it totally preventable. That's in a 20-year span.
Wow.
So we thought, how hard could it be to do the same thing for mental health? End the stigma, get more investment in science, and fix the system. And I at least greatly underestimated the difference in how difficult this was going to be.
Yeah, I mean, in terms of mental health, I mean, like you said, every country is a developing country. I thought that was really an astute point. And I mean, yeah, growing up for me, it wasn't really part of the conversation. I mean, I grew up in the South, in South Carolina. And like looking back, I wish that it had been more in the conversation. I wish we had a better understanding. I think there's a lack of general understanding in our country how important mental health actually is to your physical health. And so I think the closer we get to understanding that, and just, I think we are opening up some in terms of being able to talk about mental health and starting to alleviate some of the stigmas, but there's still a lot of work to do.
Yeah, and I thought my family was uniquely unlucky. And what I found out was that mental health is really the biggest challenge in healthcare. It's bigger than the combination of cancer, diabetes, and respiratory illnesses like asthma and COPD.
Yeah.
It's the leading cause of disability worldwide. So this is when I started really focusing on it, because I'd been working on what I thought were the leading healthcare issues, but mental health eclipsed all of them. And the opportunity to improve was so huge. I mean, it's you just look at suicide rates and deaths of despair from drugs and alcohol. All these things are downstream effects of it. And you said mental health affects physical. Well, physical also can lead to mental health issues. If you have cancer, you're twice as likely to develop anxiety, depression. So this was really the biggest challenge. And I was working for a company and a leadership that thought there was an opportunity for us to do something big on it. So I spent the last 6 years in the company working on bringing the global community together around mental health, kind of the way we tried to do on HIV. And one of the biggest challenges till today is that the mental health community is very fragmented. There's just not enough funding. Yeah. As I mentioned, the quality of services and the coverage is fairly low, and so there's not a lot for people to galvanize around. But we spent the last 6 years trying to bring people together and put our heads together for a better outcome. And I think we're making some progress.
Yeah. And how long were you in that mental health role with J&J?
It's about 6 years, yeah.
Okay.
So until I stepped down at the end of last year.
And I'm curious, do you have any advice for maybe some employers that are listening on how they can best provide mental health support for their employees and their organizations?
Yeah, one of the unexpected outcomes. I mean, I started thinking we would focus externally on governments and systems, but right away our employees started coming to me by the hundreds and then the thousands, saying, "What about my family?" And this was consistent with this notion that my family was not uniquely unlucky. This was kind of everywhere. And once you start having a conversation, you find out that almost every family has got challenges in mental health. So we. And my company is very good about employee health, mostly on the physical side.
Yeah.
And so we were we went through this journey, which other companies, to answer your question, can follow as well. Number one, you got to start talking about it,
Yep.
just like you do about cancer now. And if you break your leg, everybody signs your
Right.
cast. This is just another type of challenge that is
Yeah.
actually easily treatable if you can get people connected to the right kind of care.
Mm.
But you as a company can help make that connection for people. You have to support your employees. We do a lot of storytelling and at all levels of the company. And then we have a dedicated team. Johnson & Johnson has a dedicated team that wakes up every morning. They had nobody 6 years ago. Now there's, I think, 20 or 24 people who globally are looking at how do we engage our employees, how do we engage the providers and the payers, how do we create awareness so that people don't have to struggle when they're, struggle to find an answer when they're really having a hard time. They already know where to reach for the answer. So there are a lot of things that people can do, but the first thing, start the conversation, start to address the systemic issues,
Yeah.
and try to normalize it, treat it just like any other
Yeah.
issue.
Yeah, no, I think it's so important to try to normalize it, treat it like another issue, like you said. And I saw that you were also the global chair for the Alliance for Diverse Abilities Employee Resource Group. Could you tell me some more about that?
Yeah, so like I said, employees were coming up to me by the hundreds and then the thousands, and so we got together with a number of people in the company, and the head of our DE&I group
Yep.
said, well, why don't we start an employee resource group, like the ones for LGBTQ or veterans or African Americans. So we started an ERG for, at that point it was 1,500 employees. When I left, there was about 5,000 employees who live with mental illness either as a patient themselves, which is 1 out of 4 employees,
Wow.
according to statistics. I mean, it's very common.
Yeah.
And then, or as a caregiver like myself, and that's about 2 out of 4 employees. It's just about everybody. We later found out it was the first ERG, employee resource group of its kind in the world, anywhere. And then we went out to other employers and helped them set up similar organizations. So now we have a big movement that's both, our ERG at Johnson & Johnson was really a driver of a lot of the systemic changes in the company. First of all, just getting focused on it and starting to hire a team to try to figure out what we could do about it, but also telling our stories and then going out to other organizations and enlisting them in the cause. So that was an unexpected, really, and maybe it was the most impactful thing that we did, was getting the grassroots up in arms, up and speaking their voices, and driving the change. And I'll give you 2 quick examples.
Yeah.
So I went out to Singapore to open our employee resource group there, and I was whining about how in the United States it's hard to get coverage.
Yeah.
And somebody raised their hand and said, "Well, what do you mean mental health is covered in the United States?" Because in Singapore, mental health was not part of the benefit package. It's in the U.S. Dental care is usually outside the.
Right.
Well, in Singapore, mental health was outside the whole package.
Wow.
So our company worked with other companies and the payers to now create a standard whereby mental health is just part of the whole healthcare insurance package.
I mean, that's huge impact. I don't want to discount that. I want to stand on that for a moment. I mean, that's a whole country of people that were affected and now potentially have mental health resources available to them.
Well, and Singapore is the regional headquarters for most multinationals for Asia Pacific, so
Right.
it had this knock-on effect. But it all started with the employee engagement and activation. That's something I would have even thought of doing.
Yeah.
A similar thing happened in the U.S. where when you can get care, it's usually out of network, so you're paying out of pocket for it. It's not covered by insurance. Right. And because of our employees raising this as one of the main issues, we worked very hard to to broaden our network of providers. And so when we started, we had about 15% of mental health was in network compared to cancer, which was like 99% in network. By the time I left at the end of last year, we were over 70% in network mental health, just by working with the payers and the providers. So that was, again, driven by the employees saying, this is my number one challenge. Can you try to help fix it? And again, something we wouldn't have thought of right out of the box.
Yeah, it's really cool to hear, and it sounds like you had tremendous impact on J&J as an organization and on the globe in your time there.
Yeah, the last thing about these ERGs is that our ERGs would go out to universities and high schools and recruit So you think about LGBTQ, you go out and say, hey, come work for this company because it's a great company, and you can belong here, you can be yourself, you can really contribute. So our mental health ERG started going to universities and high schools and talking about how if you are the 3 out of 4 people who are living with mental health in your family, you don't have to hide it anymore. You can come here, you can talk about it, you can get the care you need. You can also be part of this larger movement that we're building globally around mental health. And so it became a recruiting competitive advantage for the company. J&J competes against Amazon and Apple and Microsoft, all the big leading edge companies. And so for at least a little while we had an advantage. Now they're all kind of in the same game.
Yeah.
And as you know, young people are talking more openly about mental health now, so that they don't want to go back in the closet, just like an earlier generation didn't want to go back in the closet on the LGBTQ issue. And so we created an environment where they could come and be part of a movement. And more importantly, I think we spread that movement globally to other employers. And so we're seeing a real rising tide.
Yeah.
Now, have we changed the system yet? Not as much. We've made a startup, but we've got a long way to go.
If you're enjoying this episode, I would greatly appreciate if you could review, like, comment, or subscribe on your favorite platforms. Your engaged support goes a long way in helping the show grow and getting our impactful guests heard. Now back to the show.
Yeah, I mean, it's really cool, though, that you guys were able to set that example and, like you said, create that rising tide. Certainly a lot of work to do, but one step at a time is how we get there.
Yep.
Yeah. And so now you are the co-chair of the National Action Alliance for Suicide Prevention. Can you tell me about what took you into that role?
Well, we were looking for ways to make a systemic change, and the National Action Alliance is essentially the U.S. Mental Health Reform Commission. It's a group that has been around for a number of years and is trying to find ways to change the trajectory of mental health for the United States. And it's the A team around the table. So it's a public-private, government-private sector. On the government side, we have the Surgeon General. We have the White House Special Assistant to the President for Mental Health. We have the head of the National Institute of Mental Health, the head of the CDC, which looks at population health, the head of SAMHSA, which is the mental health agency. We have the Department of Defense because of all their issues with PTSD and suicide, Veterans Affairs, HHS. And then on the private sector side, if you think about it, I'm going to tell you who's important to be around the table because it's not obvious to you, but the first people that interact with somebody with a mental health issue are often the clergy. So we have the faith community at the table. The second place that unfortunately most Americans interact is with law enforcement. So we have the chiefs of police at the table.
It's so important.
And other first responders, the EMS and so forth. We also have Facebook, because social media is both a contributor to mental health for young people, but it's also, they've done a lot to bring people together and provide information and community. We have health systems like Kaiser. We have the sport leagues because Brian Love and DeMar DeRozan in the NBA, Michael Phelps in swimming, Simone Biles and gymnastics. And there's so many people coming out of the network. And they touch young people. They have a platform. They're also trying to take care of their own athletes and staff. So they're part of the conversation. It's an amazing group of people. And what we're trying to do, Jeff, is we've got a very comprehensive strategy, but it's too big. We've got to find 1 or 2 dials that we can really all collectively push on.
Yeah.
And that's what we're going to try to do over the next 6 months. And I was brought in as co-chair, I believe, because I'm the private sector co-chair. There's a Veterans Administration now as the government co-chair. But I think the group was struggling to find a focus and a way to be efficient and almost more business-like. So they wanted a business person who had looked at knotty problems and found 2 or 3 ways to make a difference. And that's the journey we're on right now.
You've implemented plans for change, so it definitely seems like a great fit. And when you mentioned some of those big names, big organizations, celebrities, athletes that are involved, practically, what does that mean in terms of them being involved and being in the conversation?
Well, the group before I got there formulated a national strategy. We're now refreshing that, but it's everything that you would want to do to fix mental health and substance use is part of that. in order to eventually prevent the worst outcome, which is a suicide or a death of despair. So it's everything from, I mean, one thing that stood out about mental health is it starts in the young.
Yeah.
Half of it starts by the age of 14 and 3/4 by the age of 24. So we need to get into pediatricians' offices who have little training. We need to be involved in schools where teachers are already overloaded with lots of other responsibilities. We got to work with law enforcement so that kids don't end up in jail rather than in treatment.
Oh, yeah.
And then there's employers. We talked about when people get into the workforce. There's also a fairly big burden among older people who are losing their community, or they're fighting health issues, and so it is a lifelong thing. But there's a big opportunity early in life, and I think that's where. So if you think about the strategy covering all those things, and also looking at the basic science and the investment that has to go on there that hasn't happened at its scale yet, it's a very broad strategy, and everybody around that table is doing important things within the context of that strategy.
Yeah.
But I think as a group, as leaders, our opportunity is to find one or two things that will make the biggest difference. And I'll give you two examples of things we've done already.
Yeah.
One is, have you heard of 988 yet?
Yes, I have.
So,
Yep.
it used
But
to be you had-
the viewers maybe not.
Well, so 988 rolled out last summer. It used to be you called 911, the police came to, confront you when you're not at your best.
Your mental health crisis. Yeah.
So that doesn't always end well. 988 is the new three-digit number for if you have a mental health crisis, and instead of having law enforcement come, you get the goal is to have a trained providers to come out to de-escalate, and then connect you to care.
Yeah.
Denver's actually a pioneer in this. The Mental Health Center of Denver, the STAR program,
Yep.
which you mentioned on your program before.
Yeah.
So in Denver, if you call 911, you have a good chance of having a team of mental health professionals come instead of the police or with the police. And that has led to, I think for every dollar spent in that program, Stanford University did a study. They found that it saved $3 to $4 in criminal justice and in the health system costs, so people
Yeah.
aren't going to emergency rooms.
That's awesome.
So that's an example of what this group did in the last 4 years. And so we need to find things like that
Yeah.
that only this group can do collectively. 988 would not have happened. It was a great idea, but to have all these people pulling on their piece of the pie to push this thing through Congress, to get it appropriations through from the federal government, state government, local government, and then to get these people trained up and put in the field, it really took that kind of collective focus. And so that's what we're looking for now. The 988 is sort of the crisis response, so it's at the end of the process. It's sort of like waiting for cancer to get to stage 4.
Right. Versus preventative care.
So
like,
our goal, I think, is to try to get upstream,
Yeah.
and we will decide what that is as a group. I don't know what it's going to be, but I suspect it'll be in this area of youth mental health. Here in Colorado, last year, for the first time in history, the leading cause of death for adolescents is suicide.
It's heartbreaking.
And that just shows you how urgent this is, and how much we need to lean into this.
Yeah, I mean, it truly is a crisis. It's so great to hear about all the people putting the work in. Obviously, there's a lot to do. And, specifically, as you mentioned, law enforcement, I'd be remiss not to dig in here a little bit, given my experience in criminal justice reform. Within our criminal justice system, there are a lot of people that have severe mental health issues that were put in jail, because of that. Is there any work that you know of going on to try to bring mental health resources into prisons?
Yeah. Let me sort of broaden this frame a little bit. So the three largest mental health facilities in the country are the jails in Chicago, LA, and New York.
Wow.
And I think in most studies show that a majority of people in prison have serious mental ills, clinical, serious schizophrenia, bipolar, certainly substance use. So unfortunately, we because we don't have a strong mental health system, we let the prison system take over. So there's an initiative called the Stepping Up Initiative that the National Association of Counties has, and other stakeholders like Johnson & Johnson, like the National Action Alliance, are working to look at every step of that process that leads someone to end up in jail and try to intercept it, try to divert them. So one of the things that researchers have found is that most people who get arrested who have mental illness and end up in jail had been in an emergency room in the last 3 months.
Wow.
So there was an opportunity to get that person connected to care, but more often than not, they were kind of catch and release. And so we lost that opportunity, and it fell to the jails and the law enforcement. So we're trying to interrupt that chain or that pipeline for the mental health community. And then, to your point, there's a big problem in the prisons because people are not necessarily getting their medication.
Yeah.
And then when people are released from prison, you know better than I do that usually you're given a $5 bill and a bus ticket or whatever, but no one's giving you an appointment with a psychiatrist
Right.
or a month's supply of pills. So how do we? That's sort of the back end of the
Yep.
pipeline. How do we address that? And there are a lot of good people working on it, but as we've said already a couple of times, there's still a long way to go.
Yeah, it's tremendous and important work. I thank you for it. And I also wanted to ask about your role as a senior advisor at Edelman Global Advisory.
Well, I'm trying to be as retired as I can be on the the money making side, but Edelman is one of the leading public relations firms in the world, and they work on all kinds of policy issues for both the private and public and nonprofit sectors. They're actually I think this is well, they're the public relations firm for one of the largest mental health advocacy groups in the country. I'm not sure I can tell you who it is, but it's probably public record. And recently, a year ago, Edelman, like a lot of PR firms, decided to expand its services. They brought in a management consulting policy group, which was led by all of my best friends from my years doing global policy.
Right.
And they said, hey, we know this mental health thing is big. Do you want to come on and help us understand that and put the resources, not just of Edelman, but Edelman serves almost every company you can think of.
Yeah.
And every government, every nonprofit. They have this amazing network. And we get all these people together around a couple of initiatives. And so we're starting to ideate around that. And it has the opportunity to be global, but obviously also the United States.
And how long have you been working with them?
Just since I think it's March, I think. Yeah.
Okay, so it's been short term so far. Even it's early, but are there any specific examples of what you guys are doing that you can share?
I think it's very similar to what we talked about with the National Action Alliance. There's a
Yeah.
lot of things you could do, but what are if you got a lot of the leading employers together, what are the 2 or 3 things you can do? I know for a lot of employers and clients for firms like Edelman, there's a burning platform, which is their own workforce.
Right.
They're seeing, especially post-pandemic, just huge rates of burnout. They're starting to become aware of the substance use and depression, anxiety, and rising suicide rates. So, and they're also seeing, as I mentioned, young people coming into the workforce who are really advocates around mental health. So let's say you have an older senior leadership team, and all these young people are coming and saying, "Well, we want mental health care. What does that look like? How do we help our older employees? How do we help our younger employees?" So, for a lot of these clients, I think maybe the big opportunity is to do the workplace mental health piece, and then maybe if we got to do 2 bites of the apple, we would collectively come together in some kind of public campaign that would lead to systemic changes, maybe around kids or maybe around young adults.
Yeah. Yeah, it's great to hear that that's going on, and we don't have tons of time left, and I still want to get to my big questions. But before we do, I just wanted to bring up, that your son Peter's involved in mental health, and I wanted to get an understanding of, how your work in mental health has changed your relationship. And I know we've talked about potentially having him on with you for a follow-up in the future.
So let me just give you a little teaser about Peter, and you should really explore with him because he's a much better spokesperson on this whole issue than I am. Peter won the NCAA soccer championship, Division III with Tufts. He scored a goal in the final. He was on the all-tournament team.
Awesome.
And a month later, he was in jail.
Wow.
And it was all related to mental health. And Michael Phelps talks about this. When you reach the pinnacle of your athletic career, and you've always imagined that you're going to suddenly feel better.
Yeah.
And Michael Phelps, you might know his story. He went home after the London Olympics when he had become the winningest Olympian of all time. And he locked himself in his apartment for 5 days and thought about ending his life because he thought, I'm never going to feel better than I did in London. I still feel really depressed, which he had been his whole life, but sports had kind of kept it at bay. And a lot of athletes have this, it's called the Olympic blues, when they, and my son had the same thing. So it's an interesting story. So it's criminal justice, it's mental health, it's sports, all the things that you kind of that define who you are in a lot of ways. So I encourage you to get him on the show. And
Yeah, no, I'd love to have them. And it's thinking about the athletes like that is really interesting because I think it applies in a lot of other areas of myself, one of my areas of interest is film production. And I think about sort of that high when you're coming off a long time on set and you're with all your friends and your coworkers and it's this big rush. And then all of a sudden it's gone, the day shooting ends. And I think there's a lot of examples like that in a variety of industries.
yeah, and you mentioned something there. Is you have all your friends in your community, and some of that falls away after your career's done or your movie's done. And I think people know that one of the best things you can do for yourself is stay socially connected.
Yeah.
It's hard to do when you're feeling down and you're kind of on a downward trajectory, but one of the best things to pull the ripcord and get the little lift for yourself is to force yourself to be around friends and just connect.
Well, I look forward to discussing that with Peter. And, I'm curious, is there a story in your life where you really just saw how much your work was affecting change and it really hit you?
Well, I've been fortunate throughout my career, starting with human rights and then going into public policy and law and healthcare. Almost everything I did, I had this wonderful mixture of having a good career and also having an impact that was positive for people. On this mental health journey, there were a couple of moments where I just realized that I had bitten off something that was way bigger than I knew. So we had this within Johnson & Johnson, a TEDx J&J event every year, and I asked the folks if I could come and talk about my new initiative on mental health. And we had some rehearsals. Now the actual event itself was amazing. That's where all these thousands of people came out, but the first time I knew that I was out of something really big was we had a rehearsal. And there were 6 coaches who were listening to you, try to put your talk together. It was very rough at that point. And they had the big lights on, so you couldn't really see. If you've been on a stage speaking, you can't see a goddamn thing.
Right.
So I stumbled through my first draft of this thing, and I walked down underneath the lights, and I came up to these 6 coaches, and they were all crying. And they told me, they all started telling me, this is so important to me. And that's when I realized, oh my God, this is not just about my family. It's not about even the policy issues, which are kind of dry. This is really touching people at a gut level. And it just took off from there.
Yeah.
Which is why it's easy for me now that I'm sort of semi-retired is to say this is my mission now, is to continue down this path because the need is great. I just have the network and a knowledge base and a skill set where I can maybe make a difference. Yeah. And you just get the impact is just huge.
And I think like the mission that you've dedicated yourself to in this point in your life is a good example of like a way to deal with things after retirement. We talked about, athletes specifically, when they retire, life is so different. And so many of them are looking for ways, and missions and things that they need to do or ways to stay engaged. So I think yours is a great example of how you're doing that.
Well, I'm still grappling with going from 120% to 20%.
Right.
It is an abrupt slowdown.
Yep.
But my wife and I are finding ways to have meaningful purpose and also just enjoy life a little more.
Yeah, I'm glad to hear that.
It doesn't hurt that we will have our 6th grandchild in 2 months, and we have 5 kids across the country. So and my parents are still alive and siblings, so we have a lot of family and then there's hockey friends.
Yep.
That's a great community that you built, and I'm just lucky to be part of that here.
I appreciate it. Yeah, it's thank you for sharing that. Congrats on all the grandkids. That's amazing. And if you'd like, at this point, you can ask me a question.
Well, you can decline to answer, but you indicated earlier that you had some mental health experience in your family, and part of what we're trying to do is normalize the conversation. Yeah. I always caution people that you shouldn't talk about something you're not comfortable about because there are still a lot of frankly negative views about mental health. But if you want to participate in the movement, this might be a chance to say a little bit about
Yeah.
what your experience has been.
I mean, I'm wide open generally. I think it's important to talk about. And, I mentioned growing up in the South and how it wasn't really much of a conversation. But yeah, I've dealt with anxiety as long as I can remember, at a variety of different levels. And especially when my dad passed away when I was 20, like it was just a lot to deal with. I've been in therapy since then, and it's been incredibly helpful for me. And so I'm on a constant journey of trying to work on myself and improve my mental health, and certainly struggle at times. There's other members of my family that have dealt with some mental health issues, and for me, it's a daily thing that I think about and try to be conscious and aware of, because it's going to affect everything that I do. And it's also now as a parent, it's going to affect the way that I parent.
Yeah,
And, I have a 3-year-old and 8-month-old, and it's certainly on my mind, like, what am I doing that's going to affect their mental health in the future? Clearly, growing up and my parents and my, for good and bad, affected my mental health. So I try to be really aware of it.
And you talked about exercise and the community
Yeah.
as one thing. What are there 3 or 4 other things that you do when you feel like you're?
Yeah, I mean, certainly playing hockey is a big one, and having that community, I would say, for me, a good sort of relaxation escape is watching film content and, sort of digging in. I like deep stories about rich characters, and it kind of gives me a different perspective of someone else, and these things that are written really nicely. So that's part of it, and also just staying in close touch with my family and my friends, and just trying to be as open as I can with people.
Yeah, that's
Yeah.
great. And the other thing that's very important for a parent of young kids is sleep.
Yes,
You're
and
going to be at a deficit for a while, but
it's tough to come by.
we talked about social connection, exercise, sleep is hugely critical,
Yeah,
and then the other one is nutrition. So
yeah,
that means moderating alcohol use, but also eating healthy food, not all the junk food that's out there,
yeah,
because that feeds your body, and it also your body affects your brain. So
Yeah.
it's all connected.
yeah. I mean, my relationship with food, we could probably do a whole podcast on. It's
Yeah.
nutrition's been up and down for me. It's something I struggle with. It's a big part of my mental health, but I certainly agree. And sleep for me is hard to come by for me and my wife right now, but we're working on it. It's certainly a really important part of making it through everyday life, and important for people to acknowledge that. And another thing that I'd be remiss not to mention is that cannabis is a big part of helping my mental health. I'm a big drug policy advocate, but I'm also a big cannabis consumer. And I've found over many years of sort of trial and error, found the products that work for me. And it's different for everybody. And so there's certain strains that I use to relax, certain ones that help me focus, certain ones that help me be creative. And it's certainly been a help in reducing my anxiety in a lot of circumstances.
Yeah, and you mentioned therapy, so I would say medicinal products. Let's say that includes some pharmaceuticals.
Yeah.
Or, they don't work for everybody.
Yeah.
It's a trial and error and kind of calibration.
Yep.
But you sound like you found a good mix, and I appreciate your being open and sharing, because that's how we make a difference.
Yeah. No, absolutely. And I'm going to skip a little bit here down to our big question at the end, just given our time crunch here. So, the question that I ask every guest: if you could snap your fingers and fix one thing in the world, what would it be, and how do you think that change would reverberate?
Well, apart from U.S.-China relations, which we talked about,
Yeah.
no, but for me it's mental health. I want people to treat mental health just like any other health issue. I want us to especially for young people, get to it early before it becomes stage 4. And I think the outcome is going to be fewer deaths of despair, suicide, alcohol overdose, opiate overdose, and people leading and thriving, more meaningful lives.
Yeah. Yeah, I mean, it's incredible to think what just a shift in global mindset around mental health could do for the health of our entire world. And there's so many countries that are even further behind than us, and it's really sad to think about. So yeah, I mean, if we can be in a world where that's the case, I think we'll unlock a lot of potential in people. I think the same way that people are bogged down by trying to survive every day, that don't have the resources they need, and that's what comes up in this question a lot. Mental health is doing the same thing. It's closing off potential of so many people because they're not getting the care and support that they need. So I really appreciate your work to get us closer to that future.
Yeah, and as you point out, even if you don't have access to medical care or medicinal support, there are these basic things you can do. Try to get sleep, try to eat well, try to get some physical activity. It doesn't have to be high cardio stuff that we do on Friday morning at ice hockey. And then just try to keep your social connection because people tend to retreat.
Yeah.
There are things you can do without any expenditure of money that are available to everybody globally if they're aware of it. That's the kind of awareness you're trying to spread.
Yeah. Well, I've really enjoyed this discussion, and I'm sure that it's kind of making some people think that are listening. How can people generally support you, your impact, your work?
Right. I think first of all, if you see somebody who's struggling, to ask them how they're doing it, not just as a passing thing, but how are you really doing it? How can I help?
Yeah.
You can take a thing called mental health first aid, just like CPR training. It's available globally.
We'll make sure to link something about that.
Yeah, if you just Google mental health first aid, and then it'll ask you to put your zip code or country in, and it'll tell you when the next sessions are. Usually free or, $20 or something. But that will make you give you the skills to help your loved ones, and if even people you see on the street or in work, you'll know how to interact with them and how to refer them to care, just like you would do with the CPR. You're not the doctor, you're not the heart surgeon. Stabilize, refer, connect.
And now you create somewhat educated citizens that can then go and spread the message and suggest others to go into this. So you create messengers for this important work.
Yeah, and then if you want to get involved in the bigger picture, you can join NAMI, the National Alliance for Mental Illness. That's the leading advocacy group. If you're on the scientific side, you can work with the National Institute of Mental Health in the United States. And then on the system side, there are a lot of groups working to try to improve healthcare. Here in Colorado, the Mental Health Center of Denver is one important place, but nationally there are other groups. So there are lots of ways to get involved. And then finally, if you're in a workplace, you can get involved in your workplace mental health.
Yeah. Well, we thank you so much for being here, and to remind the audience, we're here live at the Podcast Movement Conference in Denver. We were provided this space for free by Yap Media and GoBox Studios, so we're really appreciative of that. This was a cool opportunity for me to do the show in a little bit of a different way, and want to thank Craig so much for coming out here, doing this. Thank you so much for your work. I'm really excited to continue our conversation, continue playing hockey together, and hopefully spread the word on mental health and helping to alleviate the stigma.
Thanks a lot, Jeff. Appreciate all you do.
Appreciate it.
Thanks for listening to this episode of People Are the Answer. If you enjoyed the episode, share it with friends, and reviews or subscriptions on your favorite platforms go a long way to help the show grow. I want to share these incredible people and their remarkable work with as many others as possible. Thanks for your support. For more, go to peoplearetheanswer.com.